I was 27 years old when I lost my first patient, dying with AIDS. It was 1982. No one knew what caused it or how it was spread. It was a scary time. Even after human immunodeficiency virus, or HIV, was discovered, it still wasn't completely clear that HIV caused AIDS. Prominent scientists disagreed. It was the beginning of a pandemic. Fast forward to 2022, now we know that HIV causes AIDS because we've got 40 years of accumulated evidence, and we know how to treat it. And yet, the other day I heard about a man living with HIV who refused medication because he was sure HIV did not cause AIDS. He had papers from the 1980s that said so. By his unshakable belief, he was literally sentencing himself to death. Now we are faced with another pandemic, COVID-19. And again, there are major disagreements. How is it possible that people can argue so vehemently about what to do about COVID-19? Perhaps it's because each of us has a limited point of view. Do you know the poem about the 6 blind men and describing an elephant? It's from an Indian fable, right? So each blind man has his hand on one part of the elephant, maybe the ear or the leg or the trunk. No wonder they can't agree. I love this verse from the poem. And so those men of Hindustan disputed loud and long, each in his own opinion exceedingly stiff and strong, though each was partly in the right, and all were in the wrong. Anyone here ever experienced this? Not so much about HIV or elephants, but about disagreeing with someone. And you argue, and you argue, and you get nowhere. This is a story about Nobel Prize-winning physicist Richard Feynman, in which somebody interrupts a lecture he's giving to say, "You just contradicted a theory you proposed years before." Feynman replied, "When I find out I'm wrong, I change my mind. What do you do?" Sometimes people get stuck on an idea, and it becomes a belief so strong that they can't change their mind, even in the face of new information. For example, the belief that COVID-19 is not a real threat. The consequences of this have been tragic. We've had almost 1 million people die in the United States from COVID-19, 90% of them unvaccinated, and more than half of those after vaccine became widely available. Misinformation kills. When this is all over, when we return to a new normal living with COVID-19, will we be in a better position for the next pandemic? I fear not. Not only have our scientific institutions taken a huge credibility hit, but so has science itself. How evidence-based have our policy decisions been? Now, I know there have been lots of social considerations as well, but still, how many decisions have been based on opinion rather than fact? I thought it might be worthwhile to talk a little bit about how science is done, what has changed recently, and how the public hears about science, and why you shouldn't take everything you read at face value. So, has anybody ever done this? You know, drop Mentos into a bottle of Coke, right? You get this geyser of soda. Yeah, that's my family. But what if you, as a scientist, wanted to know more? Say you have an idea. Mentos aren't so special. I bet any candy will do. You are a scientist, so you don't just voice that opinion. You have to test it. So you do some experiments. Compare Mentos with Skittles, get results, analyze your results, draw conclusions. This is a scientific method. You write it up, send it to a scientific journal. It gets peer-reviewed by specialists in this area, and then your paper is either accepted or rejected. There's a major glitch in this system, though. It takes too much time. You're doing science in a pandemic. You want to share your results with other scientists as soon as possible, even if they are just preliminary. So, a rough draft called a preprint is posted online. As soon as I send my paper on Coke and Mentos to the Journal of Gaseous Explosions, my rough draft is publicly available on the internet. Now, no other scientists have checked my methods, double-checked my statistics, or critiqued my conclusions. And maybe I did make some mistakes. Some of those bottles of Coke were old and kind of flat. The peer review process picks up on this. My paper is not accepted. It's never published in a scientific journal. But the preprint is still out there. The news media has picked it up, and it has made headlines. Coke and Mentos, a hoax. I mean, all kidding aside, this is a serious problem. I don't think most people know what a preprint is. It is a study that could be full of errors and never published in a scientific journal, but it still can and does make headlines. Now, this isn't all about preprints and the news media. The problem also lies with poor communication from our science institutions. For example, this ad from the Food and Drug Administration. It's supposed to warn people about the dangers of taking a medication formulated for animals, but it's insulting. It's dismissive. Basically calls people stupid. Poor communication. A bit of arrogance. You know, there's another Feynman quote I really like. I would rather have questions that can't be answered than answers that can't be questioned. I fear that sometimes science is presented as having answers that can't be questioned. Many people have been frustrated during this pandemic, complaining, you can't trust those scientists, they're always changing their minds. Well, yes, science is iterative. COVID-19 is a new disease. What we learn today may change what we thought yesterday. Why haven't we been more upfront about this degree of uncertainty? For example, it should be no big surprise that vaccinated people can still get a COVID infection. That was always a possibility. You know, vaccine doesn't put a magic bubble around you and virus particles bounce off. I mean, you could still be exposed, breathe in the virus, and get an infection. What vaccine does is prevent progression to severe disease. A shot in the arm won't keep virus out of your nose, but it can go a long way for keeping you out of the hospital, out of the morgue. I thought HIV was going to be the defining disease of my career. I actually retired in 2014, knowing that we had gone from a really terrifying time, helpless against the loss of life, millions of people dying from AIDS, to HIV as a manageable condition. So when COVID-19 hit in early 2020, I, like many others, knew we needed all hands on deck and came out of retirement to help minimize loss of life from another deadly virus. For me, as a physician, this experience has been so frustrating. People working in HIV desperately wish we had a vaccine to prevent AIDS as safe and effective as we have for COVID-19. It is heartbreaking, the amount of misinformation that has circulated about a vaccine-preventable disease. So now what do we do? Well, science needs to learn to communicate better with the public. And our scientific institutions, they need to rebuild trust. And the general public needs to get better at distinguishing science from pseudoscience. I want to leave you with 3 main points. Number 1, think critically. You see a headline, Coke and Mentos, a hoax. Take it with a grain of salt. Don't conflate opinion with data. Number 2, be skeptical of dogmatic assertions. These days, everybody seems to think they're an expert in COVID-19. Remember the 6 blind men describing an elephant. Lastly, be like Feynman, especially during an emerging event like COVID-19, where many hypotheses are generated, and with time, some are proven false. If you find out you're wrong, change your mind. Thank you.